We'll start with a mindfulness exercise so that you can really experience the benefits and the what it's like to practice a mindfulness technique, and that will hopefully help you to see firsthand how our patients and clients might benefit from using these approaches in our sessions. Then we'll set some intentions together. We'll define mindfulness and we'll talk about making mindfulness kid-friendly. And then we'll do a real deep dive into the literature review, looking at all of the peer-reviewed research that we found on using meditation and mindfulness to address the different concerns that we might come across as speech pathologists. Then we'll talk about the clinical application, and this is where we'll get into the specific activities and how you might implement them in your sessions. And we'll talk about goals and documentation so that you can feel really confident with how you write about what you're doing in your sessions in an evidence-based way. And we'll talk about mindful parenting, which is a really important aspect of this whole concept. It's an important part of being a holistic speech pathologist, really treating the whole child, including their family and their community, so you can really maximize the ripple effect that you have. We'll talk about therapeutic presence, and then we'll go through some resources and different things that you might want to look into if you want to learn more after this talk. Before we get into the research on how mindfulness is used in pediatric practice, Jen and I want to share this graphic that we created that helps to really describe why this matters in your clinical practice. So you can see in this graphic that meditation and mindfulness lay the groundwork for positive socio-emotional skills. And in the research articles that we looked at, by far the biggest measurable benefit that the researchers identified were in the areas of attention and self-regulation. And you can see that these two things have a trickle-down effect on all of these other skills, including communication. And one thing to note is that humans often regulate by communicating. And a lot of the kids that we work with, in fact, all of them probably, have difficulty with communication from the get-go. So that already makes it difficult for them to use this technique of communication to self-regulate. On top of that, many of them are already dysregulated. So they are in that fight or flight response. And when you're in fight or flight response, you're really no longer able to learn, attend, and process information. So addressing that kind of calm body and the fight or flight response might make these kids more able to be open for learning. Of course, that has an impact on their ability to follow directions, process the emotions of themselves and others, and that all ties into pragmatics and general communication skills. So if we can teach our kiddos how to access that calm nervous system with self-regulation, then they might be more able to go out into the world and be able to communicate more efficiently in their daily lives. And it's really ideal if we can teach them to do that independently. So all of these techniques that we're using, they really emphasize this self-awareness, being able to look at our own selves by way of noticing physical sensations of the body, of how we respond to certain feelings and thoughts, and that can help kids be able to then notice that in their daily lives and be able to regulate themselves more successfully and then be able to communicate and be more effective in their daily lives. So we often don't really recognize how much stress might impact our kids because, their lives seem pretty simple to us. They don't have a mortgage. They aren't maybe as concerned about the future of the world. But Jen is going to get more in detail and look at how stress might be affecting the kids that we work with. Here's an example of how you might document using one of these techniques in your practice. And I just picked one of our favorites, Breathing Buddies, and a possible SLP goal: child will follow 2-step directions in 3 out of 5 trials with mod cues. So you can see how I wrote this out, and in the note, and this is in Brenda style. It's maybe you write your notes very differently from this, but you can get the flavor of how this might work. And so you can see that I don't hide the fact that we're using a mindfulness practice, and what we're doing it for, body awareness and focused attention, and the fact that it is evidence-based, you can throw that in there if you're concerned about that, being that communicating that in your documentation. And then just like we always would, whether you are playing a game, a card game, or hungry hippos, or a mindfulness technique, you can use the same language of the patient following two-step novel commands and the accuracy level, taking the data on that. And then you get the benefits of also encouraging improved body awareness and attention as well.